My name is مراد. I'm a plastic surgeon from Riyadh, Saudi Arabia. I'm associate professor at Al Faisal University. Today I'll be talking about the role of the pedicled mentalis muscle flap in closure of the chin implant incisions. As you know, there are many ways and different methods to augment the chin. This is for patients with retrogenia or retrognathia, whatever you want to call it. And unfortunately, it's both reconstructive and a cosmetic procedure for these patients. The different methods we know of is genioplasty, which our oral surgeon colleagues are more acquainted with. And the other simpler approach is to use implants, whether silicone or porous polyethylene implants, usually called MedPor as a company's name. In 2019, the American Society of Plastic Surgery announced that there were 16,500 chin augmentations. What we're looking for in any surgery, as you know, is to have an approach that is easy for the patient and the surgeon with less complications. If you're familiar with the procedure in genioplasty, it's more complicated with nerve damage, asymmetry, and rotation of the implant, especially if you go with an intraoral approach. So we're trying to find a better solution, much easier, less edema, less time in the operating room, and here are where the implants would come in. However, as you all know, in surgery, any foreign material that we use in the body can get infected. So we try to minimize this infection as much as possible. Less infection, less fistulation, and less implant exposure. For example, when we do breast implants, silicone implants, these are hidden behind all the tissues of the breast and sometimes the muscle as well, so it's deep seated. Similarly, in the chin, we want that implant to be hidden as much as possible. Other implants in the nose or in the ear can get exposed because the layer of skin that's covering them is very thin. So the approach, here's the mentalis muscle, and we want it to cover the implant. And of course, when you do that, this will help close the lip and the mouth and makes the mouth more competent in these patients. So the surgical technique that I'm proposing is to dissect the skin flap on top of the mentalis muscle. Okay, so you have 1.5 centimeters of subcutaneous incision, subcutaneous dissection above the muscle. So what we used to do is to cut directly through the skin, through the muscle, down to the bone. What I'm proposing here is to lift that layer of skin on top of the muscle to free up the muscle, so it'll help you with closure, especially in large and extra large implants. So here I've freed up the muscle from the top and from beneath, where I have the implant pocket. I'm dissecting the implant pocket and I have that muscle layer. Over here you see the implant is in place, and it's a large porous polyethylene implant. In many surgeries in the past, it was extremely difficult to close that muscle on top of it to protect that implant. After this, I close the muscle completely, so I don't want to see any implant material, whether silicone or porous polyethylene implant, and then another layer of deep dermal sutures, and then the subcuticular, and then my dressing. So the methodology of our study was a retrospective analysis from January 2018 to December 2019. I had 15 patients who underwent this procedure with chin augmentation with the variable implants, whether silicone or porous polyethylene implants. The mean follow-up of these patients was 4.7 months. I had 2 complications. One of them was a single case of a cutaneous fistula due to an underlying radicular cyst. So usually in these patients, in the cosmetic practice, we do not ask for preoperative X-ray. It's cumbersome. The rate of this complication happening is very low. However, we ask the patient if they have any dental issues or not. This is an incidental finding, and it opened up. I've published another study describing this case. And it ended up with explanting the implant and packing, then referred her to my dental colleague who treated the fistula, the radicular cyst, and the patient is fine without an implant now. There was also a single case of mandibular nerve territory numbness. This is not related to our study, and we just treated it with implant edge trimming and then put it back in, and the numbness went away. So in conclusion, an implant-based chin augmentation deploying the pedicled mentalis muscle flap is very promising. It's a very simple technique, as you've seen. It adds seconds to my operation, not minutes, seconds to the operation. It's very effective. I haven't seen, alhamdulillah, any infections till now, and it's very safe. We need, of course, a larger sample size with a robust design to make this more robust. That's it. Thank you very much.